In daily pathology, we'll be looking at the following topics, that is pathologic calcification, tumor markers, and also RS cell and its variants. So firstly, moving to pathologic calcification. So pathologic calcification is nothing but deposition of calcium salts in tissues other than the enamel or the osteoid. It is also known as heterotopic calcification, and there are two main types of calcification under this, that is dystrophic calcification and metastatic calcification. Dystrophic calcification is deposition of calcium salts in dead and degenerated tissue, whereas the metastatic calcification is the deposition of calcium salts in normal tissue. And in case of dystrophic calcification, the calcium and also the serum calcium level are normal, whereas in metastatic calcification, the calcium metabolism is deranged and the sodium calcium level, there is hypokalemia. And talking about reversibility, the metastatic calcification is reversible, whereas the dystrophic calcification is irreversible. And highlighting on the causes of dystrophic calcification can be due to necrosis and also hematomas, dead parasites, atheromas, Mockenberg sclerosis, certain tumors, cysts, calcinosis cutis. And moving to the metastatic calcification, causes can be hypoparathyroidism, bone destructive lesions such as metastatic carcinoma, myeloma, and prolonged immobilization, hypervitaminosis D, milk alkali syndrome, hypercalcemia or in infancy. And talking about the pathogenesis of dystrophic calcification, there is increased binding of phosphates with necrotic and degenerative tissue, and this in turn it binds to the calcium forming and forms calcium phosphates, precipitates. And moving to the metastatic calcification, there is increased precipitation of calcium phosphate due to hypercalcemia in sites such as stomach, blood vessels and cornea. Now we'll be talking about tumor markers. Tumor markers are nothing but biological markers which are found in blood, urine, body tissue, and it is elevated in presence of tumor cells. So talking about some important examples. Firstly, there is oncofetal antigens. So under this, there's AFP and CEA. AFP stands for alpha fetoprotein and CEA stands for carcinoembryonic antigen. AFP is mostly associated with hepatocellular carcinoma, non-seminomatous germ cell tumors of testis, and CEA, it is associated with cancer of bowel, pancreas and breast. Then moving to the enzyme type, there is PAP, that is prostate acid phosphatase, NSE, that is neuro-specific enolase, and also LDH, that is lactic dehydrogenase. PAP is found in prostatic carcinoma, NSE is found in neuroblastoma, and also oat cell carcinoma lung. LDH, that is lactic dehydrogenase, is found in lymphoma, Ewing's sarcoma. And moving to the hormones type, there is HCG, calcitonin, VMA, that is nothing but vanillin mandelic acid, and also there is ectopic hormone production. So in case of HCG, it is associated with trophoblastic tumors, non-seminomatous germ cell tumors of testis, and About calcitonin, it is found in medullary carcinoma thyroid, and catecholamines and VMA, it is associated with neuroblastoma and also pheochromocytoma. Then ectopic hormone production, it is associated with paraneoplastic syndromes. Then moving to some common cancer associated proteins, there is CA125, that is related to ovary, CA15-3, that is with breast, CA19-9, that is with colon, pancreas and breast, CD30 is related to Hodgkin's disease, anaplastic large cell lymphoma, CD25 hairy cell leukemia, and ATLL, that is adult T cell leukemia lymphoma. And also there's PSA, that is prostate specific antigen, that is, as the name suggests, it is for prostate carcinoma. And monoclonal immunoglobulins is with multiple myeloma. Now we'll be talking about RSL, that is nothing but Reed-Sternberg cell. So this RSL is mainly found in case of Hodgkin's disease, and identification of this RSL can suggest Hodgkin's disease, but it cannot be a 100% surety. RSLs can also be found in case of infectious mononucleosis and other forms of lymphomas. So biopsy must also be taken into consideration, and finding out the histological points. So talking about the varieties of RSL, there's classic RSL. It is the large cell and it has a bilobe nucleus, and mainly it appears like mirror image of each other, and it is the nucleus that is present. It is eosinophilic, and there is nucleolus with a clear halo, and the most significant point is there is owl eye appearance that is seen. Talking about the cytoplasm, it is abundant and amphophilic. Then moving on to lacunar type RS cell, it is smaller and it has a lacuna or a pericellular space, and this shape is believed to be due to shrinkage of the cell cytoplasm, and it is found mainly in nodular sclerosis, that is a variety of Hodgkin's disease. Next, moving on to polyploid type. Polyploid type, the main common point is that it is the shape of a popcorn, and it has a lobulated nucleus. This is what leads to the appearance of that of a popcorn, and they are mostly found in lymphocyte predominant type of Hodgkin's disease. Then moving on to the pleomorphic RSL, they are the feature of lymphocyte depletion type, and they have a pleomorphic and a typical nucleus. Thank you.